Synthroid, also known as levothyroxine, is used to treat an underactive thyroid, also known as hypothyroidism. It works by replacing or providing more thyroid hormone, which is normally produced by the thyroid gland. This is important for maintaining normal mental and physical activity. In children, having enough thyroid hormone is important for normal mental and physical development. Synthroid is also used to treat other types of thyroid disorders, such as thyroid cancer. It is important to take this medication as prescribed by a doctor and not to use it to treat infertility unless it is caused by low thyroid hormone levels. The daily dosage and optimal timing of taking Synthroid will vary depending on individual circumstances, so it's important to follow your doctor's instructions. Before you start taking Synthroid, make sure to read the information leaflet provided by your pharmacist. Always take this medication as directed by your doctor, usually once daily on an empty stomach, 30 minutes to 1 hour before breakfast. It's important to take it with a full glass of water unless your doctor tells you otherwise. If you are taking the capsule form, swallow it whole and do not crush or chew it. For infants or children who cannot swallow whole tablets, you can crush the tablet and mix it with water, then give it using a spoon or dropper right away. Do not prepare a supply in advance or mix the tablet in soy infant formula. The dosage of Synthroid is based on your age, weight, medical condition, lab test results, response to treatment, and other medications you may be taking. It's important to use this medication regularly to get the most benefit from it, so try to take it at the same time each day. It's crucial not to stop taking Synthroid without consulting your doctor first, as thyroid replacement treatment is usually taken for life. Also, do not change brands without consulting your doctor or pharmacist. Certain medications can decrease the amount of thyroid hormone absorbed by your body, so if you are taking any of these drugs, make sure to separate them from Synthroid by at least 4 hours. If you experience symptoms of low thyroid hormone levels, such as tiredness, muscle aches, constipation, dry skin, weight gain, slow heartbeat, or sensitivity to cold, make sure to inform your doctor. Hair loss is a possible side effect during the initial months of taking Synthroid, but it's usually temporary as your body adjusts to the medication. If it persists or worsens, be sure to inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks of side effects. Many people who use Synthroid do not experience serious side effects. Notify your doctor immediately if you experience any serious effects of high thyroid hormone levels, such as increased sweating, sensitivity to heat, changes in mental state or mood, fatigue, diarrhea, tremors, headaches, difficulty breathing, bone pain, or easy breakage of bones. Seek medical help right away if you experience very serious effects of high thyroid hormone levels, including chest pain, rapid or irregular heartbeat, swelling in the hands, ankles, or feet, or seizures. Although extremely rare, if you notice any symptoms of a serious allergic reaction to Synthroid, such as a rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not an exhaustive list of possible side effects, so if you experience any other effects that are not mentioned here, be sure to contact your doctor or pharmacist. Do not use Synthroid for weight loss. Taking normal doses of Synthroid will not help with weight loss, and taking large doses can be very dangerous, especially if combined with diet pills. It is important to take Synthroid exactly as prescribed by your doctor. It is usually taken once a day on an empty stomach, at least 30 minutes to 1 hour before breakfast. This medication is used to treat an underactive thyroid gland, hypothyroidism. It replaces or provides more thyroid hormone, which is normally produced by the thyroid gland. Before taking Synthroid, it's important to let your doctor know if you have any allergies or if you're allergic to any of its inactive ingredients. It's also important to discuss your medical history with your doctor, especially if you have conditions such as heart disease, high blood pressure, or diabetes. If you have diabetes, it's important to monitor your blood sugar regularly while taking Synthroid and to report any unusual symptoms to your doctor. It's also important to inform your doctor of all the medications and products you use before undergoing any surgical procedures. For children, it's important to keep all medical appointments so that the doctor can monitor their treatment, as they may be more sensitive to certain side effects of Synthroid. For older adults, it's important to be aware of the potential side effects, especially related to heart health. If you are pregnant or breastfeeding, it's important to discuss with your doctor as they may need to adjust your dose or provide guidance on breastfeeding while taking Synthroid. It's important to be aware that Synthroid may interact with other medications, which could affect their effectiveness or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never make any changes to your medication dosage without first consulting your doctor. If you or someone else has taken too much Synthroid and shows severe symptoms like passing out or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222 for your local poison control center. Canadian residents should call a provincial poison control center. Overdose symptoms may include a fast, irregular heartbeat, loss of consciousness, confusion, or seizures. It is important not to share Synthroid with others. Your doctor may recommend lab or medical tests, such as thyroid function tests, while you are taking this medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Synthroid, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one unless your doctor instructs you to do so. If you miss 2 or more doses in a row, contact your doctor. It's important to ask your doctor in advance what to do if you miss a dose and follow their specific instructions. Make sure to store Synthroid at room temperature and keep it away from light and moisture. It's important to not store it in the bathroom and to keep it out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly dispose of it when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.